We all went into healthcare, kind of with this moral, ethical passion to help people improve and get better. And we were leaving a lot on the table. We were seeing everything from our diagnostic turnaround times to how those patients were coordinated in their care journey from the emergency department to the interventional suite to the intensive care unit, how the teams were mobilized and how they communicated with each other. We wanted to find something that kind of wholly encompassed not just stroke, but vascular in general. So things that could help with PE, potentially DVTs, looking at brain bleeds, so not just ischemic strokes. Truthfully, we felt like Aidoc was the best future-proof option. And what I mean by that is we got a really clear idea of the vision of Aidoc and how they wanted to continually expand their portfolio, getting it on board. It can be challenging sometimes to get new physicians or physicians engaged with new software or new equipment, but they could immediately see the value that it could have on their workflows and their turnaround times, and so we're completely for it right off the bat. We're a primary stroke center, so we have a comprehensive stroke center right down the road. Well, guess what? I'm faster than they are now, and it's because we are super engaged and organized with how we communicate now, along with augmenting ourselves with software, really nice equipment, and some other things too. I picked randomly 3 ischemic strokes that had actual interventions, and from the time that those images were sent, and I'm specifically talking about the CTAs of the brain, to the time I had a notification on my phone was less than 60 seconds. So even beating, the median turnaround time sometimes is just astronomical value that you could get in 1 minute. You're getting a positive notification on your device. We have called ourselves in for strokes multiple times. So, the traditional pathway of a stat radiologist reading the positive, calling the ED doctor. He calls the neurologist and the interventional radiologist. One of my docs have gotten the mobile notification while they're out in town, at 9 p.m. and they see that it's definitely a positive. They turn the car around, they call the stat radiologist in the chair, get a confirmation of what they're seeing. And we have been here at the hospital with the team preparing the table, getting a call for the patient. And when we first get the phone call from the ED physician saying, "Hey, we have a stroke for you guys, we want to go ahead and call you in," and we're like, "We're already here," and that is huge. And we have done that multiple times, and that's made its way up the ranks of the hospital leadership. They're so impressed that we've called ourselves in for these cases because we're that much more efficient. Aidoc, what we felt like was they weren't just selling us software, they were selling us care coordination. And that is where AI is going to shine over the next few years.